Prostatitis treatment. So let's say orthopedically I cleared it all. Rib cage, diaphragm, lumbar spine, a little bit of thoracic, sacrum, hips are decompressed, legs are aligned, pelvis is rotating. Beautiful. Orthopedically, you're the perfect specimen. Okay, so now let's talk about pelvic floor. We have 3 layers of pelvic floor. I have to make sure that every layer is not tight, it's symmetrical left to right. You know how to contract it, but then you also know how to bulge it out and relax it, right? That's motor control. I also have to make sure that your type 1 and type 2 fibers are properly acting, because some are fast twitch and some are slow twitch. That's endurance. So when you're upright and your slow twitch fibers need to kick in and keep you upright and not get exhausted, I have to train you to do that. But also, when you're done peeing and I say, can you flicker to empty your urethra, I have to make sure that your fast twitch fibers are doing the job. So I train you both. I also have to make sure that every internal muscle inside your pelvic floor is trigger point free, spasticity free, that left side and right side are engaging symmetrically. If I say contract and your left side is engaging and the right one is slacking and just following slowly, I have to fix that. That tells me either this one is weak, it's not getting enough neurological feed, it's probably spastic. So I have to work on this muscle and train you to go symmetrically. I have to also make sure that your front and your back is symmetrical. So you're not putting too much pressure on the rectum and not enough pressure to the front or the other way around. I have to also make sure that you're not constantly bombarding your lower abdominals and building trigger points, and this is why you are having penile pain, right? Which gives you perineal pain, which now gives you rectal pain, and all we're thinking that it's coming from the prostate. When it comes to prostatitis, it's orthopedic work, it's pelvic floor work, but because for prostatitis it always has a pain component, there's neurological work, including talking to your brain, because I have to fix that neogenesis. I have to tell your brain, I fixed it. This perfect human being is in front of you. Stop causing spasticity, pain, and pelvic floor dysfunction, and telling your lymphatics to constantly decongest. I also give you a very extensive package. From the beginning, you're going to start accumulating of how to fix yourself orthopedically, neurologically, lymphatically, brain exercise, and how to release your own trigger points. And then we talk about comfort zone, right? Some people say, I'm not doing it with my own finger, you can't make me, there's no way. And other guys will say, all day, every day, I'm really comfortable, but I will never ever touch a wand. And some guys are like, I'm only doing it with a wand, not with my finger. And some people say, no, internal. So I have to be very creative and think of how do I teach you how to release your trigger points and spasticity internally on daily basis with a very strict regimen so you don't injure yourself. So you could do this on your own, and slowly I start to phase out and you take control of your pelvic floor. So when it comes to prostatitis, it's not just the prostate, it's the prostate and the entire body on top of it.